Good evening, friends. Welcome back to Medical News Today. It is May 31st, 2026, and today, we are witnessing a massive shift in how we treat the world's deadliest diseases. Segment 1, the Pancreatic Cancer Breakthrough. Right now, a major clinical breakthrough is taking center stage. The pharmaceutical company Revolution Medicines has just released highly anticipated clinical data on its new pill, daraxonrasib. This isn't just another incremental drug. It's a targeted RAS inhibitor that zeroes in on the KRAS gene, a mutation found in over 90% of pancreatic cancer cases, 45% of colorectal cancers, and 30% of lung cancers. For decades, pancreatic cancer has been an aggressive, untreatable death sentence. This pill aims to change that by turning off the cancer's main engine from the inside out. We are looking at a future where precision oncology replaces blanket chemotherapy. But that is only our first stop today. In this briefing, we are covering the World Health Organization's aggressive new stance on nicotine traps, a breakthrough nasal spray that reverses brain aging, and why your sleep routine might be broken. Let's dive in. Segment 2, Global Health Alert, the new nicotine trap. Segment 2, Global Health Alert, the new nicotine trap. According to the latest data, at least 40 million children aged 13 to 15 are actively using tobacco products globally. But the threat has evolved. Big Tobacco is pivoting away from traditional cigarettes and aggressively engineering synthetic nicotine pouches and flavored e-cigarettes to hook adolescents. The WHO warns that these products are deliberately designed to be highly addictive, easier to use, and incredibly hard to quit. Because adolescent brains are still developing, early exposure to these high-concentration nicotine products can permanently alter cognitive pathways. Public health agencies are now calling for airtight bans on marketing flavors and a complete closing of regulatory loopholes to protect the next generation before the addiction curve becomes irreversible. Segment 3, Neurobreakthroughs, Reversing the Aging Brain. Moving into the neurology labs, scientists have just taken a massive leap toward defeating cognitive decline. Researchers at Texas A&M have successfully developed an experimental nasal spray that appears to reverse brain aging. The science behind it is elegant. It targets chronic neuroinflammation and restores the brain's internal energy systems. In laboratory trials, just 2 doses were enough to calm inflammation and significantly improve memory and learning functions. Simultaneously, scientists in Japan have engineered a supercharged version of vitamin K. This compound actually prompts the brain to regenerate lost neurons. If these therapies transition successfully through human clinical trials, they will completely redefine how we manage Alzheimer's, dementia, and age-related cognitive deficits. We aren't just slowing down aging anymore, we are learning how to hit rewind. Segment 4, Everyday Health, Guava Juice, Melatonin, and Deep Sleep. Now, let's talk about simple adjustments that yield massive health returns, starting with a humble fruit. A comprehensive meta-analysis published in BMJ Nutrition Prevention and Health confirms that drinking guava juice significantly boosts hemoglobin levels. For women and adolescent girls suffering from iron deficiency anemia, drinking guava juice alongside an iron supplement raised hemoglobin levels by 1.29 grams per deciliter compared to taking iron alone. The secret is its ultra-high concentration of vitamin C, up to 4 times higher than an orange, which dramatically unlocks iron absorption in the gut. Meanwhile, if you work the night shift, a new study reveals that melatonin supplements do far more than help you sleep. Melatonin actively triggers DNA repair mechanisms, helping offset the cellular damage caused by disrupted circadian rhythms. But a quick warning for the coffee lovers: new sleep studies show that caffeine can completely sabotage your deep sleep cycles. Even if you sleep a full 8 hours, consuming caffeine too late in the day destroys the restorative quality of that sleep, leaving your brain chemically fatigued the next morning. Segment 5: The 2026 Drug Pipeline and Infectious Disease Updates. Let's look at what is coming down the medical pipeline. 2026 is officially the year of needle-free biologics. The U.S. Food and Drug Administration is accelerating reviews for oral alternatives to traditional injections. Drugs like orforglipron, a daily weight loss pill, and oral inhibitors for psoriasis and heart disease are set to completely replace painful injections, making life-saving treatments vastly more accessible. On the infectious disease front, the World Health Organization is actively monitoring a complex Ebola outbreak involving the Bundibugyo strain in the Democratic Republic of Congo and Uganda. WHO Director General Tedros Adhanom Ghebreyesus has issued a direct appeal to the international community, urging nations to avoid knee-jerk travel bans. Public health data proves that border closures hamper medical supply chains, stall response teams, and destroy the local trust required to contain outbreaks. Because there is currently no approved vaccine for the Bundibugyo strain, the focus remains entirely on rapid local screening and immediate supportive clinical care, which boasts a high recovery rate when deployed early. Implantable device. MIT researchers have developed an implantable device that controls glucose levels without immunosuppression, using islet cells and wireless power. This innovation could potentially transform diabetes management by eliminating insulin injections. Medscape. GLP-1 receptor agonist. Clinicians may improve GLP-1 receptor agonist outcomes by considering demographic, clinical, and genetic factors. Personalized treatment and careful dose titration can enhance efficacy and minimize adverse effects, advancing precision medicine in weight management. It's not one size fits all, equally. Medscape. mRNA vaccines. While mRNA vaccines are already proven safe and effective, scientists are just now uncovering new details about how they work. A new study finds they can bring about a response by entering non-immune cells, such as muscle cells, challenging the dogma that mRNA must enter immune cells, dendritic cells, to be effective. Medscape. Segment 6: Outro and Actionable Takeaway. From the optimization of everyday nutrition with guava juice to groundbreaking genetic cancer pills, medicine on this 31st of May, 2026, is moving faster than ever before. The takeaway for today is clear: the future of healthcare is hyper-personalized, preventative, and less invasive. Make sure to protect your sleep, think twice about late-day caffeine, and check the description box below for links to the full published studies on all of today's stories. Before you go, let us know in the comments, which of these medical breakthroughs do you think will impact daily life the most? Don't forget to hit that subscribe button, turn on notifications, and share this video with someone who values their health. Stay informed, stay healthy, and we will see you in the next briefing. Disclaimer: use the content provided only after verification. No responsibility will accrue to the creator of the video or to the YouTube, as it is a compiled content.